All right, so from where we left we were talking about secondary prevention, and I mentioned that we're looking out for people with conditions in the early stages because it's important that we detect, we do the treatment, and usually there are more positive outcomes if you find it you get to know that somebody has got a particular condition at an early stage. Medicine itself provides for certain measures to be put in place to reduce the development of that condition. So it attempts to limit the cause and destruction of conditions that have already occurred. So medical examples include encouraging women to have regular mammograms so that we're able to detect breast cancer at an early stage, pap tests to detect cervical cancer while they are treatable. Men also, we need to go and check for any cancers that one may have. For example, testicular cancer. When you detect it at an early stage, then you have more positive outcomes. People with high blood pressure are advised to take their medication as prescribed, regular checking up of cholesterol level periodically, and also using that as well as exercise to reduce the level of fat in the blood. So education may be key in motivating people to schedule mammograms or do self testicular examination. Schools can be very good agents for secondary prevention. And I'll give an example. Just some 2 weeks ago, went with the team for Special Olympics to Germany to represent Zambia. And one of the things that they do at Special Olympics is to conduct screening, health screening. Are we there? Hello, are we there?
Yes, brother.
Yes.
Yes. Yeah, so we did screening of all the Zambian athletes, and some we included the screening for sight, we did screening for hearing, and we did also find one of the athletes had a hearing impairment, and treatment was given. The athlete was given hearing aids. So that is what screening will do for secondary prevention. You find the condition and then you intervene. So screening can be done at schools, can be done at universities, and there are different screening activities that one can engage in. So unfortunately, the medical community insurers and most individuals have relied too heavily upon secondary prevention. We need more resources to go into primary prevention. Secondary prevention and tertiary prevention are more costly as compared to primary prevention. We want to see the disease and start treating the disease. We need to prevent the disease from occurring. The last one is tertiary prevention and prescribed specific interventions to help people with disabilities or diseases that may limit and effects of those conditions. This may also include activities to prevent recurrence of the disease, so you don't want it to occur again. It could be that somebody had a stroke and you don't want the stroke to happen again. So, and this relies heavily upon the medical care system, and rehabilitation services are part of tertiary prevention, physical therapy and occupational therapy, speech therapy, also some of those that can be used or that can be itemized under tertiary prevention. Okay, it may also include surgery, administering medications, counseling in lifestyle changes, and many other activities. Again, patient education plays a critical role, an important role also in tertiary prevention. Clients can be trained and educated after surgery to take action and reduce negative effects, and even their carers can be involved. Okay, for example, another example is those who have diabetes. You teach them on how to monitor their conditions and take corrective actions. What do they do when the level goes up? And so they're empowered to be able to take action. So there are certain other interventions that can take place at that level. It also includes behavioral change, which is one of the things that are becoming quite common because of the evidence that indicates that behavioral change makes a difference at all levels: primary prevention, secondary prevention, and also tertiary prevention. So thorough patient education in tertiary prevention can help patients understand why making lifestyle changes or following a consistent program of rehabilitation is beneficial. Why a stroke patient will need to follow certain programs that you put in place as a physio. What are the benefits of them? Yeah, and also just keeping track of their own compliance and progress. Yeah, so although we rely heavily on secondary prevention, the high cost of treatment has resulted in the majority of resources of the healthcare delivery system being directed toward tertiary prevention. So the issue of the cost effectiveness of interventions, we need to look at what is cost effective, what is the best thing for us to do. Do we have to put resources into secondary prevention, tertiary prevention? Do we need to put into primary prevention? So the golden key is that we need to prevent the condition from happening or the situation from happening. So it will be interesting to see, for example, in Zambia, how much money goes towards in the health sector, how much money goes towards uh, preventive, primary prevention, how much goes into secondary prevention, and how much goes into tertiary prevention. So a shift in resources to primary and secondary prevention could reduce the need for for much treatment and rehabilitation, which is now practiced. So more people just joining now, or they had been closed out. Okay, so every provider client encounter has the potential to provide multiple levels of prevention. So while you engage with individuals, it's possible that there could be different levels that you're incorporating. So an individual can require that your intervention is multifaceted. So there are different things that you're doing. You're also engaging in primary prevention. You're also engaging in secondary prevention. Um, okay, there are people joining. So the last few slides, also they're talking about tertiary prevention, and they include just the different things that occur in this level of prevention. So promotion of health and illness prevention, restoration of health when one becomes ill, maintenance of health, while coping with chronic long term. So again, rehabilitation and physios were the major players when we talk about rehabilitation. So as health promoters, which field physios are, we need to aim for more than just the absence of disease or infirmity mentioned in the WHO definition of health, as we know that there are different other areas that need to be looked at because an individual has got comprehensive interactions at different levels. So we must aim for overall improvement in wellness of the individual and the community, whether it's just health, it's social, psychological, it's education, it's empowerment. So an individual um, 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 is in a space which requires different things for one to be in good health. And the definition for health looks at all those different angles which we need to look at. So every patient that comes to you, there are other aspects that are important other than that rehabilitation, whether it's physical rehabilitation that you are offering. So adequately prepared professionals have an important role in achieving this end at all three levels of prevention. So it's important that we understand these levels because when you have that mind, or you have it in mind that an individual, there are different things they're exposed to, and there are different levels at which we can look at them in terms of ensuring that we have positive of outcomes. So there's a big role for health education. As you have realized that in all the stages, the levels, I have mentioned um, interventions that relate to health education. So it is an integral piece of a total health promotion program. It's a planned process, usually combines a variety of education experiences and also facilitates voluntary adaptations or establishments of behavior conducive to health. So what we want, in a nutshell, is good health. And the first thing that we are interested in is to prevent bad outcomes, health outcomes. So, and that is at primary prevention level. It may be that disease has already occurred, or we want to find out people that have the disease so we can do some screening. When we talk about secondary prevention, we find people, somebody has got a tumor, it's small, we are able to intervene, you're able to refer to services which are curative in nature. And then the last part is rehabilitate, the part of tertiary, and the most common is the rehabilitation that we do as physios, as occupational therapy therapists, some social workers, and also I think I did have mention occupational therapists, speech therapists, and many other rehabilitation workers. Any questions? So I will post another Zoom. I think in the next minute, I will post another link so that then we look at determinants of health. Those are the two things that we are addressing today. Any questions? The last 1 minute and a half before I send another link.
No, I think it's fine, Doc. No question on
Okay.
my side.
Okay. So I will, as mentioned earlier, I will post these on YouTube, on my YouTube account, and I'll send the links. You can get there, listen through this lecture over and over. If you have any questions, you can post those questions on the link. You can like the page so that any other material that I post there, which I haven't taught, you can also be able to appreciate and benefit from that. But as mentioned, exam will be based on what we would have taught this week. All right, we can exit so that I post another link in the group.